Hello guys, in this video we'll continue our question series for step 1. Okay, many of you guys are saying this that this might be, or many of you may be feeling that these questions are too small, but trust me, on your real exam also, if you narrow it down, the important part, or rather you remove the distractor, the core question will come here only. So don't worry about the length right now. Let's make this uh, a wonderful experience for you guys where we can understand the concepts. Okay, I can teach you the concepts, and trust me, all these concepts are very important for your exam. Okay, so let's start with this session. So as always, pause the video, comment down the answers in the comment section, and tell me the score. Okay, how many right, how many wrong, let me know. Let's begin. Which of the following is the most appropriate management regarding transfusion? 2 days after admission to hospital because of DIT, 37-year-old woman develops severe headache and becomes comatose on admission. Admission examination shows few petechia over lower extremities. Her platelet count was, oh my god, it's gone. Normal is 1,50,000. 3 years. 1,50,000 to 4 lakh. This is the normal count. Okay. The CT scan of the head shows intracranial hemorrhage. Platelet transfusion is recommended, but the patient is a Jehovah Witness and had stated on admission that she won't receive any type of blood transfusion. Her husband is not a Jehovah Witness and wants her to have the transfusion. Okay, which of the following is most appropriate regarding? Okay, so the patient, okay, who is a adult patient, okay, and she has she's a patient of Jehovah Witness, and she clearly has stated not to receive any sort of transfusion. So the autonomy of the patient should be the best thing to follow here. So here the answer will be do not proceed. Okay, had this patient been, let's say, 15 years, so minor patient, then answer was proceed with transfusion. But adult patient who has clearly stated, okay, on admission that she does not want any transfusion, so there is no need of a proxy to guide her management. She herself has said this. Answer is A. Next question. Where is, yes, before this treatment, so intensive multi-drug chemo is planned. Before this treatment is initiated to decrease the patient's risk for renal failure. Okay, before this treatment is initiated to decrease the patient's risk for kidney failure, it is most appropriate to administer the drug which inhibits or binds which of the following sites. So emergency department, excessive bleeding, and so she is maybe AML or something like that. She's a young, yes. Examination shows multiple laboratory shows hemoglobin is low. As you can clearly see, this is leukemia. So, and see the blasts. So this clearly states it is leukemia. Now, of course, this is a simple question. Okay, how to prevent, you know, transfusion syndrome, TLS, sorry, tumor lysis syndrome. How to prevent it? Okay, you can do many things, like you can give IV fluids, you can give xanthine oxidase inhibitors like allopurinol or asburicase. Okay, so answer will be E. Okay, that's easy here. So this is a easy question. But let's say they asked you which type of leukemia is this? Is it AML or is it ALL? Okay, what do you think? Or let's say we add CML and CLL. What will be your answer? Comment down in the comment section below. Okay, considering the blasts are high, okay, you have a 23-year-old female, so the age is on a lower side. Okay, what should be the answer? This is another concept. Comment down, I'll answer that. Okay, but this is classically tumor lysis syndrome. Okay, where we give these three things. Okay, main is IV fluid, XO inhibitors and xanthine oxidase inhibitors and raspaceuric. Okay, next. So next is, which of the following is the most likely on further evaluation of the cells? Okay, 13-year-old girl has an episode of severe cellular rejection necessitating maximum immunosuppressants. Okay, for a transplant. 2 weeks later, she develops lymphadenopathy and HSM. Lymph node is not obtained on biopsy, is obtained on shows monomorphous population of B lymphocytes. See this type of things. B lymphocyte. Okay, biopsy was obtained. You should immediately think EBV. Answer is C. Now, you may think of CMV. Otherwise, there is no option which may confuse you. So, why it is not CMV here? Because the thing, why is it EBV and not CMV? What do you think? The reason is B cells. These are classically associated with EBV. Plus, remember, she also has hepatosplenomegaly, which is also a classic finding of EBV. And yeah, that there's basically many things which say this is EBV and CMV, not CMV. So the answer here is clearly C. Next. Okay, which of the following is the mechanism for hydrocephalus? This is a question which, if you know, you know. Okay, you all have saw those diagrams. Okay, let's see. 22-year-old woman who recently immigrated from rural Mexico is brought to the emergency department after GTCS. She has 6 weeks of history of headache, nausea, vomiting, decreased visual acuity. Fundoscopic examination reveals bilateral papilledema. Okay, MRI of the brain shows enlargement of the right ventricle and findings consistent with cysticercosis. Which of the following is the mechanism? Okay, so here what can be the answer? Let's see. Obstruction of the cerebral aqueduct, obstruction of the right aperture of the fourth ventricle, Luschka or Monroe. Okay, and perforated septum paludism. No. Arachnoid hemorrhage on the right. No. Let's see. This should be the answers. 29 comes to emergency GTCS. Okay, headache and fundoscopic MRI of the brain, enlargement of the right ventricle, finding consistent with cysticercosis. Most likely mechanism. Okay, so I think here what should be the answer? Obstruction of the cerebral aqueduct, obstruction of the right aperture of the no Luschka. I think the answer should be C here. Okay, if you remember your neuroanat, the whole ventricle image was given. I think the answer should be C. Okay, comment down your answers. I think the answer should be C here. Next question. Okay, biostat question. Let's see. When repeating this study, which of the following is most likely to decrease the likelihood of beta error? So here, of course, p value is 0.05. Okay, so it is not significant. Now this is a direct answer. Of course, if you want to decrease the likelihood of beta error, the answer is E. Okay, eyes closed, you should know this. Okay, so you remember H1 H0. Okay, so this was experiment this is reality. Okay, so this both are good, but this is your type 1 error. No, this is your type this is your type 2 error, this is your type 1 error, and type 2 is also beta, and this is alpha. Okay, and power is equal to 1 minus beta. Okay, so this is your standard table, everybody should know. In experiment, if you found result, you didn't found reality, actually difference was there or not there. Okay, based on this, and the basic thing you want to know is that type 2 error, how to decrease it. If you increase the n, that is if you increase the population or the research people included in the research, you can decrease this. So you can indirectly, when you decrease type 2 error, you will increase the power. So here they can also write that what this can lead to. If you increase the people in the research, the answer is you decrease the type 2 error and you increase the power. So this is I think a easy question, direct question. Answer is E. Okay guys, yeah, so that's all for today. See you next time.